Sanford Health prides itself on being innovative, and it's quite obvious that the genetic variations that occur in society are going to underlie a lot of disease conditions. And we very early on jumped into genetics and genomics of the human condition, as we like to call it, to get a greater understanding. The primary reason we got into this is because we want to do the best for our patients. So why wouldn't we explore the human genome? So we launched a genetics and genomics program. We focused on the ACMG 59 and we focused on pharmacogenomics. Our learnings of this is that education is going to be so important. Education for the consumer. Our patients need to understand this. And also for those who are going to actually be in the trenches, our physicians. So our learnings for this is, and one of the reasons we're partnering with Helix is because we need to understand a bigger picture, not just for our health system, but for many health systems. How do you actually not convince patients, but let patients understand the significance and the importance of this? We're made up of 24,000 genes, or nuts and bolts of life as I call them. But the code of that is over 3 billion letters. So one health system, two health systems is not going to be able to figure out how to apply that to their patient base. So joining a group that has the same philosophies so we can actually understand what that code of 3 billion letters actually means and how we can actually apply it to our patients is the challenge. And it's not just a village, it's a city that's going to take to do that. So how do you work with, whether it's the payers or whether it's with the health system itself, just to get that broad base of healthy individuals that are obviously going to be predisposed to something that we don't know they're predisposed to right now. We're talking about precision medicine here. Precision medicine was founded in rare diseases. It doesn't get any more precise than a single change in the genome. What Sanford brings to this in many ways, we are a world leader in rare diseases. Not that this program is about identifying rare diseases, but it's the track record of understanding the significance of what a genetic change can actually do. So a rare disease may cause a fatal disease in a child. Often it takes 6 years to diagnose that child. So by mining the genetic basis of any other condition will help diagnosis. It's not just about treating patients to make their lives better. I find myself making an argument on the economics of this more and more. The earlier you diagnose, the quicker you get to a treatment. The quicker you get to a treatment, the less likely there are going to be other conditions or comorbidities associated to that particular disease. This is the right thing for us to do across healthcare. Better care is, and then if we can bring down the cost of healthcare because we're doing this better, we all win. The bottom line is we're all made up of 3 billion letters. We're all the same, they just jumbled around in a different order. So for us to understand the susceptibility that we may be carrying, but also the environmental influences that actually occur. I don't think anybody can argue against needing to understand the genetics of us in terms of diseases. And the bottom line is ultimately, why wouldn't you be part of this? Because you're going to be left behind. The train has already left the station. Genetics is actually going to be the future of medicine with respect to understanding the human condition.